Jane, from what you've told me, I think you could have a problem with your thyroid gland, and I'd like to have a look at you if that's all right.
Sure.
I'd like to examine your neck,
Okay.
and also have a look at your eyes, which can look a little bit different if you have a thyroid problem.
Okay.
And we can do all of that with you sat in the chair if you're comfortable.
Yeah, sure.
Okay. First thing we can do is come round and have a look at your eyes,
Okay.
which can look a little bit more prominent if you have a thyroid problem.
Okay.
And they look fine. We're also going to have a look at how your eyelids move. So if I can ask you to keep your head nice and still and follow my finger. That's fine, that's nice and normal. I'm going to just check your pulse.
Okay.
And that's normal too, that's good. And then if you can stretch your hands out for me, just looking for any tremor or shaking. And they're absolutely fine, that's great. Right, we're going to have a little feel of your neck as well. And first of all, I'm just going to have a look and see if I can see any swelling. I'm going to come behind you again and just feel for any glands. That's fine. I'm going to check your thyroid gland. I'm going to start from the middle and work my fingers out. I want you to tell me if any of this feels uncomfortable for you. Okay, I'm going to push a little bit firmer now. That feels absolutely fine. Okay. The next thing we're going to do is I'm going to have a little look at you swallowing.
Okay.
If there's any swelling in the thyroid gland, it'll move when you swallow, and that'll give me a clue. So I'll just get a glass of water.
Thank you.
Okay. If you could take a sip and swallow normally, just while I look at your neck. That's great. I'm going to come behind you one last time. If you can take some water in your mouth and just hold it there for a second for me. And then swallow. That's lovely, thank you. Okay. Right, Jane, examining you, I can't see any obvious swelling in your neck, but from what you've told me, there may be something going on with your thyroid gland, and I think we probably should investigate that a bit further. So we're now going to talk about what we're going to do.
Okay, thank you.
We've just checked your blood pressure and that's fine. What I'd like to do now is to move on to your cranial nerve examination. Now, the optician sent me a report that said that your visual acuity is perfect, and that's great, and he's also looked at your visual field, so I know they're normal too. So I'd like to start with fundoscopy. Okay, that's looking in the backs of your eyes to check for any signs of pressure. I just need to turn the light off so I make your pupils a little bit larger, okay? Okay, right. So what I'm going to do is I'm going to come up quite close, just shine a light towards the back of your eye. If you can try and look over my ear, all right, and keep your gaze that way. Don't worry about blinking. That's perfect. Keep looking over my ear. Okay, and just look towards the light for me. Brilliant. Okay, and just relax. We'll just check the other eye. Right, this time I'd like you to look over my left ear. All right. So same again. Keep looking over my ear. Oh, brilliant. Okay, and just look towards the light. Perfect. Marvellous, thank you. I'll just turn that light back on. Right, okay, I'd like to look at the sensation on your face now. Okay, so I'm just going to touch your face gently with my finger. Tell me if it's the same on each side, all right? So just on your forehead. Same on each side? Yeah. Your cheeks and your chin. All the same?
Yeah.
Perfect. I'd like us to pull some faces now, alright? Can you raise your eyebrows for me and look really surprised? Brilliant. Okay, just screw your eyes up nice and tight. I'm going to push your eyebrows. Hold them there. Perfect. And relax. If you could puff your cheeks out for me. Lovely. Show me all your teeth. Good. Okay. Can you give me a big wide ah? Okay. Ah. And again. Ah. Great. Just stick your tongue out for me, straight forward. Lovely. And from side to side. That's great. Okay. Right, I'm just going to look at the muscles in your neck now. So I'm going to put my hand on your cheek. I want you to try and turn your chin over your shoulder. I'm going to look at your neck while you do it. So just push against my hand. Okay. Brilliant. And go that way for me. Push. I'm just looking at your neck muscles. That's great, okay? Now I'd like you to bring your shoulders up. Hold them there. Don't let me push them down. Perfect, and do relax. You've not noticed any change in your sense of smell at all?
No.
And no change in your hearing?
No.
Brilliant. Okay. I'd just like to look at your coordination now. So if you can take your index finger and touch your nose.
Okay.
Okay. And now touch my finger. Brilliant. Back to your nose, my finger, your nose, my finger. Okay, and swap hands for me. The other index finger, touch your nose, touch my finger, your nose, my finger, your nose. Perfect. Okay, now I'd like to have a look at you walking. So do you want to slip those shoes off?
Mhm.
So what I want to do now is look at you walking, but I want to see you walk heel to toe. Okay, so if I just show you what I mean, pop your heel right next to your toes, and then just come across the floor like that for me. Let me just see while you do that. That's great. Okay, and now I want us to walk back together, but this time walking on our heels. If you can do that for me. Marvellous. Okay, that's great. Perfect. Okay, just relax back. I'm just going to have a look at your reflexes now. Can you just relax your hands into your lap for me? Just let them rest there. That's perfect. Isn't that perfect? And on the other side. That's great. Good. Okay, just hold hands with me. Let your arm flop towards the bed for me. Just let it relax. Good. Okay. And just relax that arm. Let it flop towards the bed. Good. Okay, fine. Just going to take the weight of your legs now. All right. Let it relax onto my arm. Okay. Perfect. Same with this one. Let it relax onto my hand. That's good. Okay, I'm just going to bend your ankles up. Just relax that foot. Let me bend it. Perfect. Good. And this one. Let me relax it. Good. Good. Okay, last of all, I'm just going to tickle the bottoms of your feet. Okay, sorry. Well done. Fine. Perfect. Okay. Now just to finish off, I'd just like to have a little look at the muscles over your head. All right? Just going to have a gentle feel, and you let me know if anything's sore. Anything sore?
Yeah, they're on the left-hand side.
Round here?
Yeah.
Okay. What about further down?
No, that's fine.
No? All right across the neck?
That's fine as well.
Good. Okay, fine. Right, well, we're all finished now. Pleased to say that was completely normal, okay? You mentioned when you came in that you were worried about a brain tumour because of that article you'd read, and I'm really pleased to say there's just no evidence of any problems at all right? What is quite interesting is that tenderness up at the back of your head. That's often caused by tension in the muscles, and it's well recognised that muscle tension can cause headaches. Now, I wonder if you want to come and have a seat and we could talk that through a little bit more if you like.
Yeah.
Is that okay?
Jennifer, what I'd like to do now is to just examine your heart and have a look at your neck and your hands, if that's okay.
That's fine.
Can we start with your blood pressure?
Yeah.
If you just roll your sleeve up for me. Just going to wrap this around your arm. Okay, I'll just have a listen to the heart. Is it okay if you just slip your shirt off before we do that?
That's fine.
Okay. Are you comfortable there, Jennifer?
Yes, I'm fine, thanks.
Can I start by just having a look at your hands? If you just hold them out in front of you, I'm just looking to see if there's any tremor that can be associated with a thyroid problem. That's fine. If you relax that hand down, I'm just going to take your pulse now.
Okay.
Okay, your pulse is 80 and regular, which is completely normal.
Okay.
Just going to look in your eyes for any sign of anemia now. So if you just look up towards the ceiling, just going to pop the lower lids down. That's great. And I'm just going to have a general look at your neck for any obvious sign that the thyroid's a bit bigger than it should be. Are you able to swallow for me?
Yeah.
Okay, that's absolutely fine. Just going to feel for the heart now with my hands. I'm just going to put my hand inside your top, if that's all right.
That's fine.
That's fine. And now I'm just going to listen. Listening to see if you've got any heart murmurs that shouldn't be there or any
Okay.
extra sounds. that's all fine. Your heart's beating nice and in a regular way. There's no problem with the thyroid gland as far as I can tell. And listening to your heart, there's no extra sounds or any murmurs there. So the examination is normal.
Okay.
I know you're a little bit worried because your mum had a heart attack. Is that right?
Yeah.
The symptoms that you're getting are not related to a serious problem with your heart, so I can reassure you about that. There are a few things that can make you feel like you're missing the odd beat, and one of them is caffeine. It might be worth us just talking through those a little bit more, if that would be helpful for you.
Okay.
Yeah? Do you want to come across the desk and put your things on, and we'll talk about it?
Okay, thanks.
Okay.
Okay, Mr. Akram, I can see that you're worried. What we need to do is we need to have a look inside the ear and also test your hearing to find out what the problem is.
Okay.
First of all, I'd like to examine around your neck to see if there are any swellings or any problems that could be causing this. Would you be happy for me to do that?
Yeah, sure.
Okay. That all feels completely normal. What I'd like to do now is have a look inside your ear.
Okay.
Okay? Again, just let me know if you feel any pain or discomfort at any time.
All right.
And I'll stop immediately. Just going to have a look on the outside of the ear first. Just going to pop this in. Okay, and on the other side now. Same thing again, I'm going to have a look on the outside of the ear first. I know this is the ear that's giving you trouble. I'm just going to have a look on the inside now.
Okay.
That's fine. It does look like there's some wax inside the ear. Other than that, it looks completely normal. Okay? What I'd like to do now is test your hearing with this tuning fork. What I'm going to do is I'm going to make it vibrate and then put the tuning fork at the back of your ear and in front of your ear. If you could let me know which sounds the loudest. Okay? Behind or in front?
In front.
In front, okay, that's fine. Just going to do exactly the same on this side and let me know which sounds loudest. Behind or in front?
I'm not sure. Can you please do it again?
Yeah, sure, no problem, that's fine. Okay. Does it sound loudest? Behind or in front?
Behind.
Behind, okay. I'm just going to do exactly the same thing. I'm going to make the tuning fork vibrate, but I'm going to put it in the middle of your forehead this time. If you could let me know if it sounds louder in either ear or sounds loudest in the middle, okay?
In the right ear.
It sounds loudest in the right ear, which is the ear that you're having problems
Yes.
with. Okay. Okay, Mr. Akram, from examining you, it seems as though there's a problem from the sound getting in from the outside into the inside of your ear. And that can sometimes be caused by a blockage.
All
Sometimes that blockage is caused by the wax that I've seen.
right. Okay.
What we'd like to do is give you some treatment for the wax, which will usually take a few days to work. If that treatment doesn't work, or if after the wax is cleared you're still having problems, it's very important to come back and see us so we can examine you again.
Yeah.
Is that okay?
Yes, thank you very
That's
much.
fine.
From what you've told me, Mrs. Strachan, it sounds like this might be an inflamed gallbladder that you're suffering from.
Oh, okay.
I do need to examine you, so if you don't mind, can you make your way over to the couch?
Yeah, that's fine.
Mrs. Strachan, I just want to have a look at your hands and have a look at the eyes first. And I'm just checking for anemia and for jaundice. Good. If you turn your hands around. Good. Okay. I'm just going to have a look at the eyes now. And if you can look up, I'm just going to pull down one of the lids. Good. And then the other one. Good. And that seems fine.
Good.
Okay. I want to have a feel of your tummy now. So if I can get you to lift up your top, okay, and just lower down your trousers, just to the level of the hips.
Right.
Perfect. Thanks. Okay. I'm just going to have a light feel over your tummy first. Is there anywhere in particular that's sore at the moment?
No, it's fine.
Okay. And that's okay?
Yeah.
Okay. I'm just going to have a feel a little bit deeper in this area here. And I'm going to ask you to take a nice big deep breath in. And sometimes this can cause a bit of pain.
Okay.
Just ask you to take nice big deep breaths in and out for me. That was a little bit sore for you, I'm sorry. Okay. If you want to get changed and to sit up, I'll take this one. Okay. From your story and from the findings, it seems as though that there may be some inflammation of the gallbladder. Why don't you come and take a seat? Let's talk about how we can help you.
Like go out and enjoy yourself, get up and study, for example.
My motivation has been going down as like life goes on, I guess. Over the past few months, it's been really hard to, I guess, get out of bed and study, even though I really just want to complete my degree and do well, but I just can't get myself to get up and study or to go out and enjoy my life and do things that a normal, I guess, 18-year-old would do.
So you were saying that the feeling down and your motivation levels going down. Did that start? Oh, you said that started a couple of months ago.
Yeah.
Yeah. So how is that impacting everything going on? Do your parents say anything about it, or is anyone noticing, how unmotivated you are?
I'm not sure if anyone's noticing, because if they are, they haven't said anything. My parents, I don't really talk to them that much or see them that much. It sounds really bad, but yeah, I feel like anytime I do talk to them, I feel this pressure to impress them and do well for them and don't want to disappoint them. And just my lack of motivation has been really affecting my studies. I'm not doing as well as I would like to, so I guess that affects how I want to talk. Like, I don't want to talk to my parents much because I'm not doing well and they'll be disappointed.
Right, so you're trying to keep a distance between the two so you don't feel bad, or you don't, you feel like you're trying your best, but you're worried that they won't actually notice that. Is that correct?
Yeah.
Right, so this is obviously quite a large pressure that you have to carry. And do you have any, you said you've got a couple of siblings?
Yeah, I have a brother and a sister.
And do they get the same pressure as you, do you reckon? Or do you reckon you're carrying the whole expectations of an older sister as well as your parents' expectations?
Yeah, that's pretty much exactly how I feel. I feel like I have to do well, set a good example for them, and also, I guess, make my parents proud while doing it all at once.
Right, so
Et toujours le mastoïde, autour du mastoïde. Donc on est en train de tourner la tête de cette façon. Donc on arrive là. Par exemple, si vous voulez travailler plus sur l'oreille, on peut travailler autour de l'oreille, 2 pouces. Donc là, la pression est beaucoup moins forte. par exemple, pour certaines contractions de tête, on peut travailler sur la tête de tête. Là-bas? Pas trop fort? Non. Et on tourne. Donc si on arrive jusqu'à ici, donc le bilan du travail est assez changé. Donc on peut par exemple travailler sur le vestibulier autour de l'oreille, autour des yeux. Donc, le main de in, ça peut être sur l'épaule, ou ça peut être sur le côté. Donc ça c'est plus le travail de vestibulier. Le visage n'est pas tellement de sujet, mais on peut travailler avec cette position. Donc notre intérêt est plus sur le nuque. Donc on vient sur le nuque. Alors, on peut descendre. Donc, si on pousse trop fort, il doit... Oh. Donc, au lieu de déplacer donc là et là, donc j'aime bien continuer à travailler. Donc, en déplaçant. Donc, maintenant, on vient dans notre acte. Donc, travaille par le pouce. Donc, base de l'épaule, le base de nuque. Donc, on est plus près de Bessie 21. Donc, ce zone est beaucoup demandé pour la pression assez forte. Donc, on peut aller là, et pour certains patients, on peut aller vers le. Ça va? Pas trop fort? Non, c'est bon.
Ils sont en en tout cas.
Mauvaise application, ces jours de fête.
Alors après, donc on travaille là, et dans la continuité, donc, je monte sur la tête. comme ici c'est une ligne, enfin, je descends. Donc, sachant que ce trajet est, on a vu le dernier.